Well, the American healthcare system has been problematic. We passed the Affordable Care Act on March 23, 2010, largely because the American healthcare system was not working well. On the access side, we had around 50 million Americans who were not getting health coverage, and that number had been increasing steadily as employers decided, because of healthcare costs, they couldn't offer insurance. And the people who didn't have insurance, they weren't lazy. They weren't what Reagan called welfare queens. In fact, they were hardworking Americans. More than half of all people who didn't have insurance were either workers or family members of workers who were just in low-paying jobs where their employer did not provide insurance and they couldn't afford to buy it. The Affordable Care Act has made a big difference to that. 8 million individuals went into the exchange, selected private insurance with subsidies from the government, a very large number. 5 to 7 million more individuals bought private insurance directly from insurance companies. 3 million young adults were able to stay on their parents' health insurance plan, and around 5 million Americans got health coverage through the expansion of Medicaid. That's led to a big improvement in terms of the number of uninsured people. As you can see in this graph from the Gallup poll, there's been a steady decline in the number of uninsured people as a result of passage of the Affordable Care Act and implementation of the exchanges. On the quality domain, before the passage of the Affordable Care Act, quality was very uneven. We had peaks of greatness, but also areas we were not so proud of. 1 in every 20 hospitalized patient had a preventable hospital-acquired infection, and tens of thousands of Americans died each year because of these infections. And there were many other problems: operating on the wrong body part, prescriptions which weren't done correctly, falls in the hospital, creating lots of human pain and suffering and costing tremendous amounts of money. There was also the readmission problem, where patients were sent out of the hospital only to be readmitted within 30 days. We've made big progress because of the Affordable Care Act on each one of these measures. Hospital-acquired infections and other complications threatening patient safety have dropped because of the Partnership for Patients created by the Affordable Care Act. Similarly, readmission rates had held steady for years and years, were dropping because of passage of the Affordable Care Act, incentivizing hospitals to actually focus on readmission and how they passed patients off to doctors and nursing homes. And finally, in the area of cost. As we mentioned, year after year, healthcare costs were growing faster than the underlying economy. In 2013, healthcare costs were $2.97 trillion, making the American healthcare system the 5th largest economy in the world. And it just wasn't abstract growth in healthcare costs. The average amount that a family had to pay for health insurance went up over 100% in the decade before the Affordable Care Act was passed. And more of the economy was going to healthcare. Well, we have seen that the Affordable Care Act actually has brought healthcare costs down. Going forward, I've made some pretty bold predictions, 6 of them. First, that we're going to have a diffusion of VIP care for the chronically and mentally ill. We are going to keep them healthy, keep them away from specialists, out of the emergency room, out of the hospital, and thereby save a lot of money. We're going to begin using a lot more digital medicine and providing a lot more care out of the hospital, out of the physician offices. And that's actually going to lead to a closure of hospitals or a change in hospitals. No longer are they going to have hospital beds with patients in them. They're going to become outpatient clinics or surgery centers or rehabilitation facilities. So digital medicine, allowing more care to be delivered out of the hospital, is going to transform the system. Insurance companies are also going to have to evolve. They're going to have to move away from just taking premium and paying doctors. They're going to have to get engaged in the delivery of care and work very closely with providers in trying to ensure high-quality, low-cost care. Employers are also going to face a big choice. With the rise of the exchange, they have an alternative to offering health insurance to their workers. They're going to have to choose between providing comprehensive health benefits that include wellness, fitness center, on-site primary care, on-site dental medicine, pharmacy benefits, diet consultants, and benefit packages that incentivize the use of these various health services, or deciding that healthcare is not in their wheelhouse, it's not their best activity, and that they're going to give their workers a defined contribution and allow them to shop for health insurance in the exchange. Well, academic health centers that train medical students, interns, and residents are also going to have to evolve. They really haven't changed dramatically in the last 100 years, and now with the downward price pressure, with the change in payment for research, they're going to have to evolve to shorten up how they train doctors, to focus more training out of the hospital where patients are going to be cared for, to train their medical students, interns, and residents in the use of digital medicine, to give them more training in management skills and negotiation and population health. If all of these things work well together, it's going to lead to getting healthcare costs under control. And the sixth and final megatrend is a prediction of the end of healthcare inflation by 2020. I'm an optimist. The Affordable Care Act has transformed the American healthcare system, and we are going to see it play out over the next decade. We can come back in 2020 and look at how good I am at making predictions and whether these 6 megatrends are going to actually unfold. We'll see. Am I better than the economists? Am I better than the dart-throwing chimps and random chance? Come back in 2020 and evaluate the success of my predictions on these 6 megatrends.